today we're going to be describing what GERD is. So GERD stands for gastroesophageal reflux disease, but it's easier said as GERD, G-E-R-D. It is when acid in food comes back up through the esophagus. So today for our demonstration, we're kind of using a weird angle, but this is going to be our stomach with all its contents inside, and this is going to be demonstrated as our esophagus. So this piece is the esophagus, which is a small thin tube that connects from the stomach to the throat. So the throat would be up here. Couple things with GERD, some symptoms, especially within kids, is poor weight gain, recurrent vomiting, generalized irritability, refusal to eat, and maybe some wheezing. A lot of this is case by case based off the child or what the food they ate was, but overall, those are some of the main symptoms. In infants and younger children, when you get kind of older, they can be seen as heartburn, abdominal pain, nausea, regurgitation, things like that. So overall, just irritability within the chest and the esophagus. So how it works is if you eat something that doesn't quite settle right with you, a lot of it can be dealt with certain acidic foods. So the contents in your stomach go back up through the esophagus. So it will go back up and it'll go outwards. It decides to go through. So usually this would be resulting in vomiting or overall nausea because it gets stuck in your esophagus and then can go out through your throat and then projectile outwards after that. So it kind of goes afterwards and goes outwards on the other end. Some ways to discover GERD: you can get a chest x-ray, an endoscopy. An endoscopy is when they put a camera down your throat and it helps see the different liquids that are happening through your stomach and the airway through that. And then an upper GI series. Some different ways to help GERD. Unfortunately, GERD does not have a cure, but there are ways to lessen the severity of those symptoms. That can be seen through a healthy diet, eating food slowly, so not rushing them. When you're sleeping, you want to sleep more elevated, so that can be included with stacking a pillow or two on top. And then you don't want to lay down right after eating a meal. And yeah, that is the simplest terms of GERD.